The worst poison destroying your nerves and causing neuropathy that doctors rarely warn you about, number 3, is in your kitchen right now. Peripheral neuropathy affects over 20 million Americans, causing debilitating pain, numbness, tingling, and weakness that can destroy quality of life. Most people think neuropathy only comes from diabetes or aging. The truth is far more alarming. Multiple common substances you encounter daily, substances your doctor probably never warned you about, are silently destroying your peripheral nerves right now. These nerve poisons, called neurotoxins, cause progressive, irreversible damage that can take years to manifest as symptoms. By the time you feel the first tingles in your feet or hands, significant nerve damage has already occurred. According to research from the Journal of the Peripheral Nervous System, environmental and dietary neurotoxins contribute to 30 to 40% of peripheral neuropathy cases, yet most patients and even many physicians remain unaware of these preventable causes. Unlike diabetic neuropathy, where the cause is clear, toxic neuropathy often goes unrecognized for years while exposure continues and nerve damage progresses relentlessly. What makes neurotoxic damage particularly devastating is that peripheral nerves regenerate extremely slowly, approximately 1 millimeter per day or 1 inch per month under optimal conditions. Damage that took months or years to develop takes equally long to heal, if healing is even possible. Severe, prolonged exposure can cause permanent, irreversible nerve death. The neurons simply cannot recover, no matter what treatments are attempted. In this video, we'll examine the worst nerve poisons causing neuropathy in the order of how commonly people are exposed to them and how severely they damage nerves. Number 7 is a medication prescribed to millions. Number 3 is likely in your kitchen cabinets right now. Number 1 is so prevalent that avoiding it completely is nearly impossible, yet most people have no idea it's destroying their nerves. These aren't rare, exotic toxins. These are common, everyday substances. Before we begin, understand this information is not about creating fear, but empowering you with knowledge to protect your nervous system. If you're experiencing neuropathy symptoms, identifying and eliminating the toxic cause can prevent further damage and potentially allow some nerve healing. Now, let's examine the nerve poisons your doctor should have warned you about. Poison number 7. Statin medications prescribed for high cholesterol. Starting with a medication taken by over 40 million Americans, statin drugs, including atorvastatin, sold as Lipitor, simvastatin, sold as Zocor, rosuvastatin, sold as Crestor, and pravastatin, can cause peripheral neuropathy. Here's the mechanism most doctors don't explain to patients. Statins work by inhibiting HMG-CoA reductase, the enzyme your liver uses to produce cholesterol. While lowering cholesterol reduces cardiovascular risk, cholesterol is essential for cell membranes throughout your body, particularly for nerve cells. The myelin sheath insulating nerve fibers and allowing rapid signal transmission is approximately 70% lipids, including cholesterol. When statins drastically reduce cholesterol production and availability, nerve cells cannot maintain and repair myelin properly. The insulation breaks down. Nerve signals slow or fail completely. Additionally, statins deplete CoQ10, also called ubiquinone, an essential compound for mitochondrial energy production in every cell. Nerve cells have extraordinarily high energy demands, using enormous amounts of ATP to maintain the sodium-potassium pumps, essential for generating and transmitting nerve signals. These pumps work continuously, consuming up to 70% of the neuron's energy. When CoQ10 is depleted by statin medications, nerve cells become energy-starved and begin to malfunction and die. Research from the journal Neurology examined statin-associated neuropathy. Studies found that approximately 2 to 5% of people taking statins develop peripheral neuropathy, though the actual incidence may be higher because many cases go unrecognized or unreported. The neuropathy typically begins insidiously, months to years after starting the medication. Initial symptoms include tingling or numbness in toes, gradually progressing upward into feet and legs in a characteristic stocking distribution pattern. Some people experience burning pain, electric shock sensations, or extreme sensitivity to touch. What makes statin neuropathy particularly insidious is its slow, gradual onset. The symptoms develop so slowly that patients often don't connect them to a medication they've been taking for years without problems. Additionally, many doctors are unaware of this side effect or dismiss neuropathy symptoms as unrelated to the statin, attributing them to aging or other causes. The risk factors for developing statin-induced neuropathy include higher doses of statins, particularly simvastatin above 40 milligrams daily or atorvastatin above 40 milligrams daily, long duration of statin use exceeding 5 years, using multiple medications that interact with statins and increase blood levels, pre-existing vitamin B12 deficiency, which is common in older adults and people taking metformin, diabetes, which already increases neuropathy risk, and genetic variations in drug metabolism affecting how quickly statins are cleared from the body. What you must do if you're taking statins and developing neuropathy symptoms is discuss with your doctor immediately. Options include switching to a lower dose, which may be sufficient for cardiovascular protection while reducing neurotoxicity, trying a different statin, as individual statins have different potencies and side effect profiles, supplementing with CoQ10 at 100 to 200 milligrams daily, which can help restore energy production in nerve cells, checking and correcting vitamin B12 levels, which should be above 400 picograms per milliliter for optimal nerve health, and in some cases, discontinuing the statin entirely if neuropathy is severe and alternative cardiovascular risk reduction strategies can be implemented. Never stop statin medications abruptly without medical supervision, as this can increase cardiovascular risk. Work with your doctor to find the safest approach, balancing cardiovascular protection with nerve health. Poison number 6, chemotherapy drugs used to treat cancer. Chemotherapy-induced peripheral neuropathy, abbreviated CIPN, is one of the most common and debilitating side effects of cancer treatment, affecting 30 to 70% of patients depending on the specific drugs used. Multiple chemotherapy agents are directly neurotoxic, damaging peripheral nerves as they kill cancer cells. The most neurotoxic chemotherapy classes include platinum-based agents like cisplatin, oxaliplatin, and carboplatin, taxanes including paclitaxel and docetaxel, vinca alkaloids such as vincristine and vinblastine, proteasome inhibitors like bortezomib used for multiple myeloma, and immunomodulatory drugs including thalidomide and lenalidomide. Here's how these drugs damage nerves. Chemotherapy agents work by interfering with rapidly dividing cells, which includes cancer cells, but also includes cells in your peripheral nervous system. Platinum-based chemotherapy binds to DNA, causing cross-links and breaks. When this happens in dorsal root ganglion neurons, the cell bodies of sensory nerves, the neurons cannot repair DNA properly and begin dying. Taxanes disrupt microtubules, the internal transport system nerve cells use to move proteins, organelles, and nutrients from the cell body down the long axon to nerve terminals. When this transport system fails, nerve endings farthest from the cell body, particularly in feet and hands, become starved of essential materials and die back. Research from the Journal of Clinical Oncology examined chemotherapy neuropathy patterns. Studies found that neuropathy symptoms typically begin during chemotherapy treatment, often after the second or third cycle when cumulative drug exposure reaches neurotoxic levels. Initial symptoms include tingling, numbness, or burning sensations starting in toes and fingertips, the longest nerve fibers most vulnerable to damage. As treatment continues and cumulative doses increase, symptoms progressively worsen, spreading proximally up the legs and arms in a glove and stocking distribution. Many patients develop severe sensory loss where they cannot feel their feet properly, making walking dangerous and increasing fall risk dramatically. Some people lose fine motor control in hands, struggling with buttons, writing, or picking up small objects. In severe cases, motor nerves are affected, causing weakness. Balance becomes impaired. Some patients require walkers or wheelchairs. What makes chemotherapy neuropathy particularly devastating is that it often persists long after cancer treatment ends. In approximately 30 to 40% of patients, neuropathy symptoms remain unchanged or even worsen for months after completing chemotherapy, a phenomenon called coasting, where nerve damage continues progressing despite stopping the neurotoxic drug. Some patients have permanent, irreversible neuropathy affecting quality of life for the rest of their lives. Currently, no proven treatments exist to prevent or reverse chemotherapy-induced neuropathy. Research is ongoing, investigating various neuroprotective agents. What patients can do is report symptoms immediately to oncologists. Dose reduction or switching to less neurotoxic alternatives may be possible if neuropathy is caught early. Physical therapy helps maintain strength and balance. Medications, including gabapentin, pregabalin, or duloxetine, may help manage neuropathic pain, though they don't stop nerve damage progression. Poison number 5. Excessive alcohol consumption destroying peripheral nerves. Alcoholic neuropathy affects 25% to 66% of people with chronic alcohol use disorder, making it one of the most common causes of toxic neuropathy worldwide. Here's how alcohol destroys nerves. Ethanol, the alcohol in beverages, is directly toxic to nerve cells through multiple mechanisms. Alcohol disrupts the lipid composition of nerve cell membranes, making them less stable and more prone to damage. It impairs mitochondrial function, reducing energy production essential for nerve cell survival. Alcohol increases oxidative stress, generating free radicals that damage nerve cell proteins, lipids, and DNA. Additionally, chronic alcohol consumption causes severe nutritional deficiencies, particularly thiamine, vitamin B1, which is absolutely essential for nerve function. Thiamine is required for glucose metabolism and energy production in nerve cells. Without adequate thiamine, nerve cells cannot generate sufficient ATP and begin dying. Alcohol also depletes vitamin B12, folate, vitamin B6, and other nutrients essential for nerve health. Research from Alcohol and Alcoholism examined the relationship between alcohol consumption and neuropathy risk. Studies found that neuropathy risk increases with both the amount and duration of alcohol consumption. Consuming more than 4 to 5 drinks daily for 5 years or longer substantially increases neuropathy risk. However, even moderate drinking over decades can cause nerve damage in susceptible individuals. Alcoholic neuropathy typically presents with sensory symptoms first. Burning pain in feet is often the initial complaint. Patients describe it as walking on hot coals or broken glass. Numbness and tingling develop, usually symmetrically in both feet. As neuropathy progresses, symptoms spread proximally up the legs. Hands become affected, fine motor skills deteriorate. Some patients develop severe pain that's worse at night, disrupting sleep. In advanced cases, motor nerves are affected, causing foot drop, muscle wasting, and significant weakness. What absolutely must be done if alcohol is causing neuropathy is complete abstinence from alcohol. Continued drinking will cause relentless progression of nerve damage, leading to permanent disability. Stopping alcohol allows some nerve healing over months to years, though complete recovery is rare if damage is severe. Thiamine supplementation is essential, typically 100 milligrams 3 times daily orally or intravenously if deficiency is severe. Vitamin B12 should be repleted with injections if deficiency is present. Comprehensive B-complex vitamins support nerve healing. Physical therapy maintains strength and function during recovery. Poison number 4, heavy metals including lead, mercury, and arsenic. Heavy metal poisoning is an often overlooked cause of peripheral neuropathy that can occur from occupational exposure, environmental contamination, or dietary sources. Lead, mercury, and arsenic are the most common neurotoxic heavy metals. Here's how they damage nerves. Heavy metals interfere with enzyme systems throughout the body. They bind to self-hydryl groups on proteins, inactivating them. In nerve cells, heavy metals disrupt axonal transport, damage mitochondria, reducing energy production, increase oxidative stress, and directly damage myelin sheaths. Lead exposure historically came from lead paint in older homes, lead pipes in water systems, and leaded gasoline. Although these sources have been largely eliminated, lead exposure still occurs from contaminated soil, certain imported pottery with lead-containing glazes, some traditional medicines, occupations including battery manufacturing, and shooting ranges where lead dust is inhaled. Lead is particularly neurotoxic to children but causes peripheral neuropathy in adults with chronic exposure. Mercury exposure occurs from dental amalgam fillings, which continuously release small amounts of mercury vapor. Consumption of large predatory fish, including tuna, swordfish, and shark, which bioaccumulate methylmercury, occupational exposure in dentistry, industrial processes, or gold mining, and broken thermometers or fluorescent bulbs. Methylmercury is highly neurotoxic, easily crossing the blood-brain barrier and accumulating in nerve tissue. Arsenic exposure occurs from contaminated groundwater in certain geographic areas, including parts of Bangladesh, India, and some areas of the United States. Pressure-treated wood manufactured before 2004, some rice and rice products which concentrate arsenic from soil and water, and occupational exposure in mining, smelting, or pesticide manufacturing. Research from environmental health perspectives examined heavy metal neuropathy. Studies found that chronic low-level exposure over months to years causes slowly progressive sensory neuropathy. Symptoms typically include numbness, tingling, and burning in feet and hands, developing symmetrically. Motor weakness can occur with severe exposure. Lead neuropathy characteristically affects motor nerves more than sensory nerves, causing wrist drop and foot drop. Mercury neuropathy often includes tremor and cognitive impairment in addition to peripheral neuropathy. Arsenic neuropathy can be acute with high exposure or chronic with low-level exposure and often includes characteristic skin changes. Diagnosis requires high suspicion and specific testing. Blood lead levels detect recent exposure but miss chronic exposure because lead deposits in bones. Whole blood mercury measures recent exposure from dietary sources. 24-hour urine collection for heavy metals after chelation challenge can detect total body burden. Hair analysis is controversial with variable reliability but may provide information about chronic mercury exposure. What must be done if heavy metal toxicity is suspected is eliminate exposure immediately by identifying and removing the source, whether occupational, environmental, or dietary. Chelation therapy using agents like DMSA, EDTA, or DMPS can bind and remove heavy metals from the body when exposure is significant. Antioxidant supplementation, including vitamin C, vitamin E, alpha-lipoic acid, and N-acetylcysteine, may help reduce oxidative damage. Testing and addressing nutritional deficiencies is important, as certain nutrients, including calcium, iron, and zinc, compete with heavy metal absorption. Poison number 3. Excess sugar and refined carbohydrates causing metabolic damage. This is the nerve poison hiding in your kitchen right now that most people consume daily without realizing the neurotoxic damage it causes. Excess sugar and refined carbohydrates don't just cause diabetes, they directly damage peripheral nerves through multiple mechanisms, even before diabetes develops. Here's what happens at the cellular level. When you consume high amounts of sugar and refined carbohydrates, blood glucose spikes. These repeated glucose spikes cause glucose to bind irreversibly to proteins in your body through a process called glycation, forming advanced glycation end products, abbreviated AGEs. These AGEs accumulate in nerve tissues, blood vessel walls, and throughout the body, causing inflammation and oxidative stress. In peripheral nerves, AGEs damage the vasa nervorum, the tiny blood vessels supplying nerves with oxygen and nutrients. When these vessels are damaged, nerve ischemia develops. The nerves become starved for oxygen. Additionally, high glucose is directly toxic to Schwann cells, the specialized cells that produce and maintain the myelin sheath insulating nerve fibers. When Schwann cells are damaged, demyelination occurs. Nerve signal transmission slows or fails. Excess sugar also activates the polyol pathway, where glucose is converted to sorbitol by the enzyme aldose reductase. Sorbitol accumulates inside nerve cells because it cannot easily cross cell membranes. The accumulated sorbitol creates osmotic stress, drawing water into cells, causing cellular swelling and dysfunction. Additionally, the polyol pathway depletes NADPH, which is needed to regenerate glutathione, your cell's primary antioxidant. When glutathione is depleted, oxidative damage to nerve cells increases exponentially. Research from Diabetes Care found that even prediabetes, defined as fasting glucose between 100 and 125 milligrams per deciliter, or A1C between 5.7% and 6.4%, increases peripheral neuropathy risk by 50% compared to people with normal glucose metabolism. This means nerve damage begins long before diabetes is diagnosed. Studies examining neuropathy in people with metabolic syndrome, characterized by abdominal obesity, insulin resistance, high triglycerides, low HDL cholesterol, and borderline high blood pressure, found that 30 to 40% had evidence of peripheral nerve damage even without diagnosed diabetes. The insidious nature of sugar-induced nerve damage is that it develops gradually over years to decades of excessive consumption. Most people consume far more sugar than they realize. The average American consumes approximately 17 teaspoons or 68 grams of added sugar daily, more than triple the American Heart Association's recommendation of no more than 6 teaspoons for women and 9 teaspoons for men. This excess consumption comes from obvious sources like soda, candy, and desserts, but also hidden sources, including bread, pasta sauce, salad dressings, yogurt, and supposedly healthy foods. What you must do to protect your nerves from sugar damage is dramatically reduce added sugar intake, aiming for less than 25 grams daily. Eliminate sugar-sweetened beverages entirely, including soda, sweet tea, energy drinks, and fruit juice. Reduce refined carbohydrates, including white bread, white rice, and pasta, which spike blood sugar similarly to pure sugar. Increase fiber intake through vegetables, legumes, and whole grains, which slow glucose absorption. Balance meals with adequate protein and healthy fats to prevent glucose spikes. Monitor your hemoglobin A1C annually, keeping it below 5.7%, ideally below 5.4% for optimal metabolic health. Poison number 2. Certain prescription medications beyond statins. Multiple commonly prescribed medication classes can cause peripheral neuropathy that doctors often fail to recognize or warn patients about. Fluoroquinolone antibiotics, including ciproquinolone and levoquinolone, can cause permanent peripheral neuropathy even after short courses. These antibiotics damage mitochondria and nerve cells and cause oxidative stress. The FDA added a black box warning about peripheral neuropathy risk, but many doctors continue prescribing these antibiotics for minor infections when safer alternatives exist. Metronidazole, an antibiotic used for certain bacterial and parasitic infections, causes dose-dependent neuropathy with prolonged use. Doses exceeding 2 grams daily or cumulative doses over 42 grams substantially increase risk. The neuropathy may be irreversible. Nitrofurantoin used for urinary tract infections can cause severe neuropathy with long-term use, particularly in older adults with reduced kidney function. Certain tuberculosis medications, including isoniazid and ethambutol, are neurotoxic. Isoniazid interferes with vitamin B6 metabolism. Supplementing with vitamin B6 reduces neuropathy risk. Antiretroviral medications for HIV, including stavudine, didenosine, and zalcitabine, cause neuropathy in 20% to 30% of patients through mitochondrial toxicity. Amiodarone, used for heart rhythm disorders, causes neuropathy in approximately 5 to 10% of patients with long-term use. Colchicine for gout can cause neuropathy and myopathy, particularly when combined with statins. Certain psychiatric medications, including lithium and some antipsychotics, have neuropathy as potential side effects. What you must do is review all medications with your doctor if developing neuropathy. Ask if any medications could be contributing. Discuss whether safer alternatives exist. Never stop medications without medical supervision, but advocate for the safest options. Poison number 1. Chronic inflammation from processed foods, oxidative stress, and sedentary lifestyle. The number 1 nerve poison affecting the most people is chronic systemic inflammation driven by modern lifestyle. This isn't a single toxin, but a constellation of factors creating a neurotoxic internal environment. Processed foods high in omega-6 fatty acids, trans fats, and inflammatory compounds activate immune responses. Oxidative stress from inadequate antioxidant intake, pollution, and cellular metabolism generates free radicals that damage nerve cells. Sedentary lifestyle reduces circulation to nerves and impairs the body's natural anti-inflammatory mechanisms. Chronic inflammation elevates cytokines, including TNF-alpha, IL-1, and IL-6, which are directly neurotoxic. These inflammatory molecules damage the blood-nerve barrier, increase oxidative stress in nerve tissues, and activate pathways leading to nerve cell death. Research shows that people with elevated inflammatory markers, including C-reactive protein, have significantly higher rates of peripheral neuropathy. What you must do is adopt an anti-inflammatory lifestyle. Eat whole, unprocessed foods, emphasizing vegetables, fruits, fish, nuts, and olive oil. Exercise regularly, improving circulation to nerves. Manage stress, which drives inflammation. Supplement with omega-3 fatty acids, alpha-lipoic acid, and antioxidants, supporting nerve health. These 7 nerve poisons are destroying peripheral nerves in millions of people. Identifying and eliminating your exposures can prevent further damage and allow some nerve healing. Which poison surprised you the most? Are you exposed to any? Share in comments. If this information helps protect your nerves, please share and subscribe for more evidence-based health content.